All right, well, good morning. My name is Garcia, and I'm a medical doctor. I went to school at the University of Massachusetts Medical School. I was a practicing anesthesiologist. I injured my hand, retired, and actually went into alternative healthcare thinking that it was a joke. I thought that because that's the way mainstream media and that's the way mainstream medical education portrays alternative treatments, anything that's not traditional, that doesn't maintain the status quo, that questions is considered alternative and not necessarily in the best interest of maintaining the medical status quo, which is very slow to change if it changes at all. Some of what you're going to hear today may go against what your belief structure is, and as a way of you being able to accept some of what I'm going to tell you, I will just remind you of all the different blurbs or the different snippets you got over the last 2 or 3 years since COVID about what was real, what was not real, what was useful, what was not useful, doctors who stood up, doctors who got punished for questioning. And the purpose of this is to tell you that when I first went to medical school, there was no such thing as Alzheimer's. There was this thing called senile dementia. Now that's a really tough sale, because if you're trying to sell somebody and you're saying that they're demented, that's not going to sell well. So they had to go and rebrand it. I don't know how the word Alzheimer or the name Alzheimer's got associated with it. Never wasted my time figuring it out. But the important aspect was that when I went to medical school circa 1977, 78 in that ballpark, dementia was a disease of the people who were 80 years old and older. Today, you're seeing what they called early onset dementia or early onset Alzheimer's. And to me, it's quite fascinating how a disease that used to just be a disease of the people who were elderly has now become a disease that is going to, in my opinion, become more prevalent in what I consider the early elderly, the late 40s, early 50s. And so when you start looking at this and you start looking at a very specific timeline of maybe, I don't know, say 40 years, which is not a very long time span in the world, you need to begin to understand that this is not occurring naturally. This is being helped along. And so I started to investigate why it is that my perception of early onset Alzheimer's was becoming a fact. And so I started to do some research. And the first thing I found out was that cholesterol is being blamed for cardiovascular disease, and cardiovascular disease during those periods of time was the #1 killer in the United States of America. And so, interestingly enough, prior to, say, 1985, women were told that they were protected from coronary artery disease. Then someone got the bright idea that, wait a minute, 51% of the population are females. We are telling half of the potential clients that they're not eligible for open heart surgery. So now it became an equal opportunity offenders. Both executive females and executive males were equally available to have heart disease and were equally available for coronary artery bypass surgeries. But when we look back around early 1970s, there was one fascinating aspect that came back. The drug Lipitor was brought into the market in the early 70s. And so now we start connecting studies done in the mid-50s with 1970s, say the mid-1970s, just to keep it easy. And we start seeing that people are now saying, like, look, cholesterol causes coronary artery disease. So about 2011, there's a document that we'll have a link to That says, it's rather small, rather a short article, so that I'll read it to you. And I quote, and this is from PubMed on 2011 October. Following their Nobel Prize-winning discovery of a defective gene causing familial hypercholesterolemia, which means that the family all has very elevated triglycerides and cholesterol levels, Brown and Goldstein misunderstood the mechanism involved in the pathogenesis, which means the cause of a disease, the pathogenesis, associated with arterial disease. They ascribed this to an effect of high levels of cholesterol circulating in the blood. In reality, the accelerated arterial damage is likely to be a consequence of more brittle arterial cell walls. As biochemists, no cholesterol is a proponent of them, and which modulates your fluidity, conferring flexibility and hence resistance to damage from the ordinary hemodynamic forces. In the absence of efficient receptor of LDL, which is the low-density lipoproteins, considered the bad cholesterol, cells are unable to use this component adequately for the manufacture of normal resiliency, the ability to flex the arterial walls, resulting in accelerated arteriosclerosis. Eating cholesterol is harmless. I will repeat this. Eating cholesterol is harmless, shown by its failure to produce cardiovascular accidents in laboratory animals, and its avoidance causes human malfunction and a lack of fat-soluble vitamins, especially vitamin D. And vitamin D is a very important component in our immune system. So the narrative became, we need to drop the cholesterol, because if we drop the cholesterol, we will reduce heart disease, cardiovascular disease, and the way to achieve this is not to change our diet, God forbid, is to use statin drugs, such as Lipitor and others. The net result is that everyone began to buy the narrative that the lower the cholesterol, the less the heart disease that you have. But let's look at the brain for a second. The human brain is composed of fat. And so when you drop the cholesterol, you drop the ability of the brain to find its food source. In other words, you're putting your brain on a weight loss program. And if you do that long enough, then your brain is not going to function correctly. And so when I grafted the number of statin prescriptions that went linearly higher and the onset of dementia or Alzheimer's, we see that the age dropped. In other words, the onset became sooner as the prescription of statin drugs increased. So I found that there was an inverse relationship. Now, this wasn't done scientifically. This was just for me, and this is my opinion. The more cholesterol prescriptions, the earlier the onset. And so I said, gee whiz, maybe cholesterol isn't such a bad thing. And so I started to look at Alzheimer's. I became interested in it. One of the things I noticed when I was researching Alzheimer's was that some people who have Alzheimer's are very pleasant. Yet some people are very frustrated and difficult to manage. And so that was one of the first questions I had to ask myself is, well, why does it come in, these kind? Why is some people just kind of like easygoing and some people rather rambunctious? And then I started to sort of investigate the process that humans go through when you start realizing and the disease progression continues. All of us, no matter what we do, are intelligent human beings. And we know what we can do, and we know what we can't do. And it doesn't take long to realize that you're just not able to do what you used to be able to do. Now, we're not talking about being able to run a marathon or being able to swim laps. We're talking about just usual routine maintenance of our daily chores. And when we begin to realize that we need help, not want, but need help, and really can't manage our daily living without a lot of forgetfulness and a lot of things just being out of sorts, a lot of people become very frustrated, especially if they were type A's and they were very successful and used to directing what other people do. I suspect that this is the reason that you have some people who have Alzheimer's that become very, very difficult to manage, because it's, I suspect, an embarrassing experience to have to acknowledge that you are no longer able to function independently of others, and more importantly, that you are becoming more dependent upon everybody else. And so embarrassment comes in, shame comes in, other emotional components come in, and type A people tend to be problem solvers. There's no solution to this problem. Conventional medicine goes to pharmaceuticals. I went to looking at the diet and other aspects. And so what have I found? Well, one of the things I found out as I was dealing with people who have chronic illnesses such as cancer is that when you have disease from about your axilla to your brain, that there's something wrong with your teeth. Now, if you go to the website, utopiawellness.com, we have educational videos, and one of the educational videos I did is about root canals. Now, one of the biggest misunderstandings, in my opinion, in medicine and dentistry is that we don't look at teeth as organs. And yet, when you look at the function of our mouth, it's very similar to any other organ. The liver cleans, processes, produces. It has a blood supply and a nerve supply. Our mouth allows us to bite, to chew, to salivate, and start the digestive process. We've got specialized teeth in the front to allow us to bite. We have specialized teeth in the back allow us to grind. You look at the pancreas got cells that deal with insulin, other cells that deal with glucagon, other cells that deal with digestive enzymes. In short, there is no difference, in my opinion, between the mouth, including the teeth, and any other organ. Now, in the process of doing a root canal, you kill its blood supply and the nerve supply. And as a result thereof, you create what I consider a gangrenous organ inside a perfectly healthy mouth. Now, one of the aspects of conventional medicine is that it is exclusionary. It doesn't like chiropractors. It doesn't really embrace acupuncture, let alone herbology. What I did when I was starting Utopia, almost 30 years ago, was I decided to become an inclusionary. And so when you start including other aspects of medicine that have worked throughout the world for numerous and numerous centuries, if not millennia, you begin to look at the body differently. And so I started to say, you know what? Every patient I've ever seen brings their teeth with them. They always bring their mouth. They don't check it at my front desk. So if they're walking in with their teeth, I need to understand what's going on with their teeth. Now, mind you, I don't have to be right. I just have to be thorough. And so we started looking at the teeth, and we find that a lot of people who have dementia have issues with their teeth. Why? Because we need to find the root cause of why it is that you have Alzheimer's. And in some cases, it could be that your teeth are infected. Toxins, which conventional medicine ignores, it doesn't really propone toxemia, can affect the way your cognition works. And so therefore, addressing issues begins to give us an inroad into, or a wiring diagram as to why you may be ill. Another aspect of why people get dementia is vascular arteriosclerosis. So one of the things that we do when people come here for dementia, and we've treated, I believe, 4 or 5 patients, all of whom have done well, um, what we need to do is use chelation therapy to clean out the arteries. We use that because the more oxygenation that we get to the brain, the better your brain's going to work. For example, it's been known for a very long time that people who have stroke, only about 10% of the stroke area is truly affected by the stroke. The other 90% can be revived with hyperbaric chambers. So I said, you know what? Let's get a hyperbaric chamber. Let's start oxygenating the brain because it's not going to do any harm, which is, by the way, the first law of medicine, do no harm. And so we oxygenate the brain. We bring in the patients and have them sit and walk them through the process of a hyperbaric dive so that they can do this on a frequent basis, so that they can start stimulating that brain to function and to wake it up. Because one of the keystones or one of the narratives that is being proposed is that you cannot rewire your brain, and in my opinion, that is not true. And so in the process of rewiring your brain, I came across certain technologies that involve frequencies that allow us to stimulate the mind so that the brain can begin to fix itself. So let me make one thing perfectly clear. Doctors cannot cure people. I cannot cure anyone except for me. My job is to help your body heal, and your body still has that capacity because it is a subconscious effort. It is not a conscious effort. And what has been demonstrated to me is that we still have that capacity even when you have Alzheimer's. So what I did not say is that what we do here works for everybody. But so far, people have improved. The sicker you are, the less function you're going to get, in my opinion. But again, I don't matter because I'm not God and I can't tell you that you're limited. So people have the ability to heal, and that's one of the secrets that conventional medicine doesn't want us to all remember. We need to remember the fact that we have the capacity to heal. We just have to stimulate it and support it, and that's what we're trying to do here. So what else screws around with our brains? Well, I found out that people who have ringing in the ears have problems with their teeth, like 90% of the time. Well, guess what? Ears are associated with the brain. So we start looking at, could there also be an infectious process, a subclinical? Now, subclinical means that you have it, but you're not showing any symptoms. Back in the COVID days, there were asymptomatic carriers. You've heard that one on TV. You know, people were walking around that looked normal, but they were carriers of COVID, and they can give you the COVID and all that good stuff. Well, that is true. You can have a disease and not show any signs and symptoms of the disease. And so therefore, we're going to treat you with simple things like vitamin C. Interestingly enough, the body loves vitamin C and will actually spend energy to take vitamin C from your bloodstream and put it across the blood-brain barrier into your brain. So your brain has access to it. So we're going to provide that for you as well. Why? Because we want to be able to cover all the bases. I suspect that the reason that people have different types of dementia or Alzheimer's in general is for various different reasons, not just one specific reason. Then the other thing we need to do is we need to stimulate your ability to rebalance, because a lot of people who have Alzheimer's have difficulty with balance. And so there are certain exercises that I've developed that people can do at home in a very safe manner, as often as you want, to expedite your ability to rewire. Your brain has the capacity to rewire in many cases. Not all. But in many cases it can. And what I've seen with people who have Alzheimer's disease is, in fact, that they are able to rewire their brain and gain a lot more function than when they first started. And one of the ways we do this is that once a week, on the same day, we videotape our patients so not only they, but that their family members can also see the process. Why? Because we have a snapshot of our brains. So if I see you every day, you will, or my brain will update your photograph. And so I may not notice subtle changes. If I see you once every 3 months or every 6 months, I may notice subtle changes to me being, wow, look at this. You changed your hair. You changed this. You changed that. Okay, this has happened to you because my brain will automatically look for the last photograph that I have stored in my memory about you and try to update it and see what the differences are. And it does that all the time. So we videotape it so that you can have a log of where you started and where you're progressed to. Because remember, the family members are going to see the incremental changes. So every day they see them, every moment they see them, they're going to be updating their database about their loved ones. We also need to detoxify, liver flush, gallbladder flush, colonic irrigations. Why? Because we want to be able to help detoxify the body so the body can get rid of its toxins so that we can move forward, or we can facilitate the ability of the body to become more alkaline. Everything that is a toxin to us is acidic. The more alkaline we get you, the better the body likes it for healing. So we need to stimulate alkalinity. We will also be analyzing the body with the machine I brought back from Russia. This machine is rather extraordinary, and it's difficult to articulate what it is. It's easier demonstrated than anything else. And we'll basically analyze the human body, which tells you what other body parts may be damaged. Why do we want to do that? Because we're here to treat the entire person. We're not just here to treat your brain. You're just not a walking brain. You're a person. No matter what disease you have. At least that's our philosophy, or my philosophy here. And so therefore, I want to know what else we can help you get back, because the more resources you have, the easier it is for you to heal. We will have you meet with our herbalist. Why? Because she's going to look at the body from a different perspective. And because we are inclusionary, we want to be able to see what else is happening with the person. We're going to send you to an orthogonal chiropractor. Why? Because the skeletal alignment of the human body is crucial to have your head communicate with your toes. And if we're trying to rewire the brain, it only makes common sense, especially if you're a quack like me, to have the entire body looked at by different practitioners so that we can get you realigned. I know it's a radical concept of bringing other people, but we're here to help each and every one of us get from here to there. And finally, we're going to be using frequency machines. The frequency machines that we use are designed to, again, to stimulate the mind, to start communicating with the body so that hopefully you'll be able to get back on track and then let the reparative properties innate to all of us get back on track so that you can move forward and regain as much of your cognition as you can, and more importantly, know how to maintain it. And in part of that is a radical change in the diet. Because what you eat will matter. And then you can just maintain the body. Maintaining the human body, in my opinion, is not that difficult. It's easy to learn. It's not that expensive. Unfortunately, the narrative is use it, abuse it, go to the doctor, get a pill, get a procedure, go back to using it and abusing it. That's not working out so hot for us. We're one of the sickest countries in the world, although we spend more money than probably the entire world combined, excluding us. So the whole purpose here is we want to have a collaborative effort between not only the patient, but the patient's family, nutrition, exercises that will re-coordinate the person, dealing with other ancillary problems that are ignored by conventional medicine, such as teeth. We will have the emotional issues addressed, because one of our colleagues here does that. So if you're angry, we want to know what's angry. We want to know if you're ashamed. We want to know if you are embarrassed because you got sick. You know, you got sick. You're not a criminal. There's no shame in being sick. I went on a boat. I got a sniffly nose. Okay? Am I going to go to jail? I hope not. But the bottom line is, we are here to deal with all of it. to give you the tools, to give your family the tools so that your family can help you. And then eventually, you'll go back to being the person you were. May not need their help. Who knows? Or may just need a little bit of help. Now, one of the things that apparently is true is that if you don't address this, the disease will continue. And this disease, unfortunately, is like a nuclear bomb. Yes, it affects the person who has a problem, but it also affects the loved ones that really care about the person. So eventually, left unchecked, this progression of disease will impact emotionally and financially those people who care about the person who has Alzheimer's. So ignoring this problem is not going to be a very wise choice in my opinion. But I leave that all up to each and every one of you. We're here to help you. The plan has worked. One of the things I noticed is, in spite of the fact that we've treated more people than have provided videos, it's the expression or the public telling that I was at one time emotionally impaired or mentally impaired that prevents a lot of the other people from speaking. There is no shame in getting well. You didn't cause his disease. It happened. Perhaps it's a result of prescriptions of statins or dietary changes or bad lifestyle, but it does have remedy. So, in essence, that's what we do here at Utopia. The aspects about caring at home, we leave that to Touchstone Home Care, because we just deal with medicine. We don't deal with the day-to-day home life. And we've teamed up with these folks because that's what they do for a living. And they do it very well. So, unless there are any questions? Okay, well, I thank you for your time, and I hope this has been of some knowledge. Go to the website, utopiawellness.com. Contact the staff. Tell them the problem. And then we can go on from there. Thank you.
Thank you. I'm Nicole with Touchstone Home Care, and we are partnering with Utopia to assist on kind of the front end and back end of this program. We have over 100 caregivers that can come in and assist and kind of be a liaison, an extra arm, if you will, for the family and partner up with the family. Our caregivers can come in. We can help with transportations. We can help with the nutrition component. We can help go to the grocery store because there is a big component there that needs to be adhered to. And so our team can do that. We can help with cooking. We can help, depending on how ill the client is, we can help with those, what we consider non-medical tasks. And maybe they need help getting up in the morning. Maybe they need help getting dressed or showered. They're weak, they're exhausted. So that's where our team can come in and help support that part of it. And we find that this is just a really incredible, unique opportunity for us as a company to help support the wellness aspect of it. We truly believe in giving a little bit more than just a caregiver that can come out. So we want to help, partner with them and be that component for anyone that's coming into Tampa, because we know that people do come in from all over the place, and they may be living at a residence for a bit during their program stay, and we can help also just be an extra liaison of question and answer to make sure that they have a very successful program with Utopia. Thank you.